What's interesting to me about medical school is the standardization of the curriculum there. So, when I went through medical school, I learned all the pharmacokinetics, how medications work. My rashes had cleared up, my prostate had reversed, my erectile dysfunction had largely corrected at that point, and my restless leg syndrome, my sleep apnea, everything went away. One time it was me by myself and I almost died. And it was a fight for my life. And I really did think I was going to die right then and there. And I could hear all the sirens, police cars coming in the distance because people saw me struggling for my life.
Hello, everyone. This is Nairi from Low Carbon Fasting. Well, today I feel honored to have our guest on our channel, and I very much hope that I can do him justice with my introduction. So here it goes. Our guest graduated Summa Cum Laude, and that's with the highest distinction, from Penn State University in 1985. He graduated, a few years later, he graduated from Villanova University School of Law. And in fact, he worked in the field of law for a few years as a law enforcement officer and criminal prosecutor before graduating from Temple University School of Medicine as a physician. He's worked as a medical examiner. He's worked as a physician in the U.S. Army as well. His special interests are preventative medicine and optimization of human health and human performance. Pardon me, in 2016, he received a grant from the National Science Foundation to research reversal of chronic diseases through lifestyle interventions, and analyzing the human genome and the human microbiome. So as I said, I'm honored to have him on board today, Dr. Sean O'Mara from Minneapolis. Welcome to Low Carbon Fasting.
Well, thank you very much, Nari. I appreciate the opportunity to be here and to speak with you and with your audience here for the opportunity to be able to share this really important information, I think.
Dr. O'Mara, as a classically trained doctor, you wouldn't have been taught about preventative medicine. So what brought you into this space where you're actually so passionate about preventing diseases, but also reversing them? So when and how did that shift happen?
Sure. So like most physicians, we get trained in medicine. And what's interesting, having been a graduate, of another professional school, law school, and the formal training that goes into becoming an attorney. What's interesting to me about medical school is the standardization of the curriculum there. So, when I went through medical school, I learned all the pharmacokinetics, how medications work, and basically how the lead up to working up a patient for medication. So all the testing, all the imagery, all the evaluations, they're all guided for the purposes of treatment. And that treatment begins either with medications, or it may be in some cases procedures, and to include surgeries. But common in all that is making money. And I don't fault anybody who does something to help somebody to make money. But if they are not doing what's in the best interest of the patient, then I have a problem. And that is really what I learned subsequent to my professional training. So as I graduated from medical school, I finished my residency, I slowly started to accumulate weight. I was following the advice that I had learned in the professional medical training in medical school to avoid eating fats, and I embraced carbohydrates. I was walking through the hospital and drinking a gallon of skim milk that had Hershey's chocolate powder in it. And I thought I was doing the right thing. And I just kept gaining more and more weight and getting a stomach on me and starting to develop back pain, joint pain, eczema all over my body, rashes and itching. I had an enlarged prostate where I couldn't pee, and I had erectile dysfunction. I had restless leg syndrome where I kicked my legs all night long, keeping my poor wife awake. I had obstructive sleep apnea, so I'd be apneic, gasping for air in the middle of the night, waking up, snoring. And I had very, very bad heartburn, gastroesophageal reflux disease, and end up getting scoped because I was on so many medications that were refractory, and they diagnosed me with precancerous lesions. So really metaplastic changes already within the epithelial lining, the cells that line the esophagus had already begun to take on characteristics of precancer. So esophageal cancer is a bad player, so I had to be scoped every 3 months looking for it. And so with all these medical problems, in the setting of that, I bumped into a patient, encountered a patient that I learned about a diet at that time. This is about 15 years ago. The diet was called the paleo diet at the time. And I embraced eating healthy protein and fat, got rid of carbohydrates. And I did something that a lot of people didn't do, I think, at that time, as I zealously left processed foods. I seemed to possess then insights and understanding that I really just had to eat more like what our ancestors did. And I had this very strong aversion to, in my quest to become healthy, to processed foods. So I cut them out, and I noticed within 1 year, back then it was 15 years ago, there wasn't a lot of people talking about it. I did it just to lose weight. I mean, I was just a heavy-set physician, just like most people, and there wasn't a lot of articles then, touting how much better you're going to feel or get when you do this. I just did it to lose weight. So without any expectations of mine, no placebo effect, I noticed that all my medical problems had gone away. I wasn't watching for them. As slow as they were coming on, and I wasn't aware that I was acquiring all these medical conditions until they got really too bad and the symptoms were too strong to ignore. Suddenly I noticed that I was, peeing once again very strong like a teenager. And I reflected on the fact that I was no longer waking up in the middle of the night. So my rashes had cleared up, my prostate had reversed, my erectile dysfunction had largely corrected at that point, and my restless leg syndrome, my sleep apnea, everything went away. And so I was just confounded. I was left in a state of dismay where I felt I ended up having this very deep sense of guilt and really consternation that I'd gone through 4 years of medical school and then 4 years of postdoctoral training in emergency medicine for what seemed to me to be fraud. I mean, I got better with just eating a diet, and I got so, I hate to say it, but so pissed off that my medical training seemed to interfere with my ability and even propagate my disease, because it left me doing what was really problematic, avoiding fat and embracing carbohydrates. And there was never a discussion about processed foods. So being so troubled about this, I couldn't explain it. There was no studies, there was no science, there's no professional training that I could refer to help me grasp how was it such a simple dietary change like that in my macronutrients could have such a profound effect on all my health conditions. So I decided out of necessity that it had to be studied, and I became a researcher. And I wanted to be a part of, I wanted to understand it better, and I wanted to be a part of the answer to how to really help people live healthier lives by becoming a researcher myself. So I moved my family to join a practice up in Minneapolis. I joined a medical research practice with a physician by the name of Dr. Zeng. And Dr. Zeng was the one who taught me about this very interesting biomarker that I learned about, which is visceral fat, which is this fat deep within the abdomen of human beings. And I had no training about it in medical school. And as I became a part of his practice where we were scanning people using an MRI, I saw with my own eyes that it wasn't just a part of the abdomen, it was the biggest part of the abdomen for the average individual. And then I thought, how could it be ignored? And there were plenty of studies that had been done by good researchers and through private efforts and not using funds from, there weren't available funds, I think, from big pharma or the traditional funding sites to do this, but they studied visceral fat. And I quickly learned just how destructive it is and how harmful it is to the human body. So armed with an awareness clinically how bad visceral fat was, and then seeing anecdotally in my practice how prevalent visceral fat was, something didn't add up. And since that time, I realized that the entire system is not one system, it's multiple systems. It's big pharma. So it's, and I know that sounds kind of conspiratorial, but it's the interest within the pharmaceutical industry. It is the interest within big healthcare. So I call it big healthcare, big medicine. So those are healthcare systems. Those are even medical practices. Those are laboratory systems, and also big healthcare insurance. So the big healthcare industry, insurance industry, all seem to have an alignment with the exploitation of disease. So what I mean by that is, they treat it. I mean, they'll it's a lot of Brownian movement, like a lot of motion. But really, point of fact is, if you're listening, does anybody really get better? I mean, the majority of people that go into the conventional healthcare system simply age and get more and more medications, more and more symptoms, and get decreasing quality of living. So their health deteriorates as they get more and more treatments. And that shouldn't be the case. And I found out that as you eliminate carbohydrates and particularly processed foods, that just the opposite happens. So since that time, I've become very passionate in this particular space. I accept the opportunities to speak on shows and podcasts and radio programs and even television, and try to enlighten as many people about the story of eating healthy. And then we've learned through our research practice that we did for 7 years for the National Science Foundation, that there are other things in addition to dietary strategies that you can do. And since that time, I've learned about those, and have now added that to my my skill set to be able to share with patients and people who really want to get healthy what they should do.
The numerous health conditions you mentioned that you suffered from, I've covered most of those on this channel before. So I think my audience at least should be aware that those are, or most of those conditions that Dr. O'Mara mentioned that he personally suffered from are caused by the state of hyperinsulinemia. Now, the restless leg syndrome was new to me. So what's happening there then?
Yeah, so restless leg syndrome, I think, really is has a mechanism through the nervous system. So peripheral nervous system and probably the central nervous system as well. And once you eliminate processed foods, tissues throughout the body, to include the neurons and tissues that make up the peripheral and central nervous system, improve as well. And so people have reported pretty widely resolution of restless leg syndrome through dietary interventions such as the carnivore diet and keto, where the improvement in metabolism also results in improvement in a physiological state where tissues can improve. So autophagy is one of the mechanisms that probably are significantly contributing to the improvement of the peripheral nervous system. And evidence of that too is my reflexes have improved considerably. I used to kind of be off balance. I would notice that from time to time I'd be in a certain position, I'd kind of lunge and, just awkward. And my twin brother was noticing the same thing in himself. I have an identical twin brother. And that departed from me about probably 3 years ago, and I have none of that. It just gradually lifted. But another interesting is how fast I can react now. So I had a failure on a video once I was trying to do for my Instagram account, where I was doing a test where you sit on the ground and you stand up without using your hands and or anything else. And in the process of doing so, I kind of had lost balance, and I was falling, and I quickly corrected my body. And I remember I was about 55 at the time, and I remember being astounded seeing this 55-year-old guy making such a quick adjustment. I mean, it's just not something that you would see a gray-haired guy be able to move so quickly. It'd be kind of a maneuver you might see in a teenager or somebody in their early 20s, but not a gray-haired 55-year-old. So the ability to adjust there also improved. And then perhaps the most significant of all really was an interesting test, if you're listening, is the ability to stand on one foot with your eyes closed. And it's typically reported in the news and on the internet and studies where how long you can stand for one, on one foot with your eyes closed. But I think that misses the mark. I don't even think it's worth even talking about how long you can do it. I think the metric there is not how long you can stand on one foot with your eyes closed, but how well you can stand on one foot with your eyes closed. So the refined metric is how still are you? How easy is it for you to stand on one foot with your eyes closed? So many people could stand for, when I started testing myself, I stood for 90 seconds and then I get kind of bored. But my ability to stand was not so good. I would be wobbling all over, and so I stood on one foot, but my other leg would be going all over the side, and my body would be contorting, making all sorts of adjustments. But today, I stand like a tree, like really, really still. And what's interesting to me is young kids do this really well, typically between the ages of, say, about 10 and 14 or so. It seems to be the sweet spot where humans can stand very, very still on one foot and in an enviable way, where adults can't do it. The kids just nail it. And so I think it's kind of cool to point out interesting things that kids can do that adults can't, where those things, and I'm not talking about like cool postings on Instagram. I'm talking about physiological, biological differences in kids because they are simply healthier. And it's not like they're born healthier than adults. It's adults simply have acquired disease and aren't aware of it. And one of those manifestations is imbalance. So if you, through autophagy, largely driven by diet and some other things that I do, such as fasting, and particularly extended fasting, you can improve neurologic tissue and indeed tissue all over your body, and you just become functionally more healthy. So I went from kind of being wobbling all over for years. I didn't have much improvement in my ability to stand on one foot without wobbling. And then after about 4 or 5 years of doing that, I tested myself once again, and I waited another year and retested myself, and suddenly I could stand like a tree. So after being really in the health space for years, and then suddenly, not having much improvement in that balance test. And then 1 year, dramatic improvement. I had to ask myself as a researcher, what was the difference? What happened in that year? And here's what it was: extended fasting. I embraced extended fasting in a way that I have not seen embraced by most people in the social media space and health space in particular, where I fast every single week for a minimum of 3 days. So I started about 2 years ago now, fasting 3 days a week, and about once a month I will fast 4 days a week. So literally, out of the month, I am fasting about 13 to maybe as many as 16 days out of the month, where I'm not eating. So sometimes literally more days out of the month I'm not eating. But the important thing about that is you really want to make sure you recover your lost meal, your lost calories. I don't count calories, but make sure when you return to eating, you're not returning to what you were typically would be eating on a normal day. You've got to get more protein in particular inside of you to help you compensate sarcopenia. So the long and short is, I think autophagy is a really great way by which my restless leg syndrome improved, and in particular my balance.
It was incredible, and I did have extended fasting on my notes. But now you mentioned it, I have to add, as a type 1 diabetic, I do extended fasting as well. Now, of course, type 1s are told not to fast. Oh no, you can't fast. No, it's dangerous. Of course, it is dangerous if you're not adjusting your insulin. But if you are able to adjust your insulin, and monitor your blood sugars closely, which at least, most people that I know do these days with a CGM. I have a CGM too. It can be done safely. I just get irritated when I hear, oh no, you're type 1, you shouldn't be doing that. If I want to achieve autophagy, there's nothing stopping me. If I can do fasting safely, why can't I do it? No one's ever been able to give me a valid reason. Oh, it's not safe. Well, there is DKA, the danger of DKA, but that can be prevented. If you're taking your precautions, if you're adjusting your insulin to a safe zone where your body has sufficient insulin on board, you're monitoring your blood sugars are normal, you're not dehydrated, why cannot a type 1 diabetic to fasting? I don't understand. So I'm so glad you mentioned the fasting for autophagy. Another benefit of fasting, if you don't mind me mentioning this, I'm sure you've noticed it in your clients and perhaps in yourself as well, is the regaining of insulin sensitivity. I do it when I notice that, okay, why am I now requiring more insulin than perhaps the week before? And sometimes it's due, if you're a woman, it's due to your monthly cycle. But if it's not that, then it's some type of food. For me, it's the cheese, unlimited dairy. If I've overindulged in dairy or nuts or peanut butter, say, or any nut butters, I notice I become insulin resistant. And the only way to regain my insulin sensitivity pretty quickly and effectively is fasting, extended fasting. And it doesn't even have to be 5 days. I've done a 5-day fast, but it doesn't even have to be that long. 1 day, skip your meals for 1 day, and the next day you're like a new person. So blood sugars are back to normal, the gut has healed, and your insulin requirement reduces again, and you feel good. Have you noticed that in terms of blood sugars?
Yes, so I haven't been following my blood sugars recently, but absolutely, when I stopped doing my CGMs about a year ago, I noticed increased insulin sensitivity that resulted from extended fasting in particular. And the other thing that I did way back in 2009, 2010 time period was when I was going paleo, I had this infatuation with insulin sensitivity. And my infatuation of it, when I appreciated, I recognized that it was a really important, ideal state. And so every article that referenced insulin sensitivity that I ever came across, I would read in any study. And so I quickly got insights into the kind of mechanisms and things you should be doing to increase insulin sensitivity. And I always applied them in my life. So I think I have unusual insulin sensitivity. And I'll share an interesting recent experience. My family at a gathering, we recently got together, the extended family with the in-laws, and we were all the matriarchs, the grandmother, my wife's mother's home, and her husband, my father-in-law, recently passed away. So it was the first time we were all really getting together after the funeral, and we were all just sitting around the living room talking, and something happened that I did that I almost never did before, and that was I took a nap right in front of these people. And what happened was, I had to think about it. My wife was furious. She just thought I was bored. I can't believe it. Felt like I had been given a drug and anesthetized through the IV with a medication. And what happened was, I was cleaning out some stuff from that I'd previously left in my mother-in-law's home, and I came across a jar of fermented garlic that one of my clients had provided me with. And this fermented garlic was interesting to me, so I consumed a fair amount of these fermented garlic cloves, and within minutes of consuming this, I had this incredible sleepy state that came across me, and I suspect it had to do. I'd never felt there was probably some carbohydrates in this garlic. And I hadn't had carbohydrates in years. So when that thing hit me, I think it produced an insulin, a shot of insulin that my body had never seen, that kind of insulin spike before. And neither had my cells ever seen that insulin effect. And so I had this very dramatic response to this fermented garlic clove. So I'll have to research fermented garlic to see what exactly happens to it when it ferments. As I looked at since then, I realized that it's really not fermented as much as it's kind of baked, and I suspect it enhances the sugars, kind of like caramelization maybe, and the garlic cloves. But absolutely, I think insulin sensitivity is a ideal state that we should be trying to achieve, and our ability to both produce and respond to be sensitive insulin really is a reflection of just how healthy we are.
I knew you would say, I knew it would have something to do with the carbohydrate. Garlic, I wasn't expecting garlic to eat garlic. I thought you might say, oh, a homemade loaf of bread or something, or a piece of bread, because that would do the same. That absolutely.
Yeah, so I probably more than anybody else have I just don't have a place for carbohydrates. And I guess you could call it an aversion. It's, I went from, before I heard about paleo, I'd just been eating standard American diet. Then I went paleo, cut out carbs. And then I went from carbs to keto, even lower amounts of carbohydrates. And then from keto, I went to carnivore, which is 0 carbohydrates. Or very, very low. You still can get carbohydrates, particularly if you consume milk, which is a dairy, animal product, but it has lactose in it, and or even liver. Liver has glycogen, so there's carbohydrates in liver. A lot of people aren't aware of it, but so I don't have any milk. I do not drink milk. I ferment it into kefir. And so I eat fermented cheese, but I don't have a place for carbohydrates in my diet. So I'm probably in our country. I'm probably right at the top for the least amount of carbohydrates consumed by Americans. My name would be at that list. And what I have noticed is that as I eliminate carbohydrates, the better I got. I mean, it was a continuum. There was a inverse relationship between carbohydrates and health. And I'd like to also make mention of feelings. So a lot of people feel like they need carbs because they just feel better when they're on carbs. And my quip, my response to that sometimes is, well, if you enjoy the feeling of carbs, you really ought to give heroin a try. So what I mean by that is we have to be careful about what tintillates, what satisfies our feelings, because we can be drawn into something that is problematic. So yes, it is not a surprise that people would feel better on carbohydrates loaded with the energy, but it's the subsequent less discernible and more insidious consequence to the carbohydrate consumption that they ought to be more vigilant to, and they tend to not see. So carbohydrates, I think, end up diminishing over a period of time your physiological state and your overall performance. At the age of 59, have never been stronger. I can do more pull-ups than I've ever been able to do, more push-ups than I've ever been able to do at the age of 59. I perform better in everything, with the exception, the one exception probably is sprinting. I have not returned to probably as fast as I could sprint when I was 16 or 19 years old, but I can still out sprint. Let's see, I got 6. I can still out sprint four of my family members, at least 3 of my children, two my 16-year-old son and my 21-year-old son can run faster than me, but the rest of the kids I can still out sprint. So the point is, I don't think I'd be able to perform in that kind of level where I still still consuming carbohydrates. So I track today as a self-avowed health and performance optimizing physician. I track my performance very, very attentively, and I watch how I perform and evaluate my health. And I think carb avoidance is a critical part of my strategy to optimize humans.
Talking of optimizing human health and performance, so what does it take to optimize health and performance? So it's a combination of nutrition, right? I mean, it's a combination of the right nutrition and the right physical activity, right? Can we summarize? Yes. In those?
Yeah. So I start, my first thing with clients is to make sure that they start eating correctly. So I recommend, and I get my clients on now. The majority of my clients do this, but not every one of them, I suppose, may not do it, or may depart from this strategy. But I recommend the ultimate elimination diet. So most people arrive to me in a suboptimal state. They're not coming to me more optimized than myself. So they recognize they got some sort of issues going on. And so I start with a plank of the carnivore diet, because in my opinion, it's the ultimate elimination diet. And it eliminates everything that could be potentially problematic, with the exception of animal products, meat. And it's just a great starting point. And I hold out for the possibility that down the road, some point in their life, they may be able to introduce other things other than animal products. But I went carnivore myself about almost 5 years ago, and I tried to introduce vegetables back in 6 times. And every time I did, I experienced some sort of symptoms that were problematic, like joint pain or back pain or stiffness, a lot of stiffness I would get. And so for me, I anecdotally picked up that this is problematic, and I just can function asymptomatically, no symptoms, if I just eat the carnivore diet and one other thing, fermented foods. So I will eat vegetables that are fermented, provided they've been adequately fermented. And people should understand that fermentation is a process by which, you know, vegetables have their forms changed, but it may be prematurely arrested. In other words, you may not ferment long enough to achieve the necessary beneficial change to those plants, namely in reducing the plant toxins and defenses that are, I believe, inherent to vegetable matter, such as lectins and oxalates, phthalates, and other forms of plant defenses and toxins, regardless of, you know, their presence, why they're there, whether they're of a defensive nature or just they serve the plant in some other form. They become problematic for humans, particularly consumed in large amounts. So I recommend to my clients to eliminate vegetables to include fruit, unless they've been fermented. With fruit, there appears to be, you know, an absence of lectins and oxalates and some of these other things. But I wonder what else might be in there that could be problematic. And one for sure is carbohydrates. So principally, I avoid carbohydrates. I do better off carbohydrates. And I can enjoy fruit, some of the nutritional value. There are some beneficial vitamins and molecules, resveratrol, things present within fruit that I get to benefit from without the carbohydrates if I ferment fruit. So I eat fermented fruit and consume that. And I recommend basically a strategy for my clients of eating the carnivore diet with fermented food. So I'm very different than most carnivores who really tend to be more purists. They only eat animal products. But I see the wisdom, value, and benefit to eating fermented fruits and vegetables, mostly not because of the nutritional added nutrients that they get, because I believe that meat is the most nutritionally dense food out there that's available to humans, but mostly because fermented foods have something that meat, if you're just eating meat, fresh meat or even frozen meat, doesn't have, and cooked meat, and that is the probiotic molecules, the not molecules, but microbes that are present within these fermented foods. So you want to be eating, I think, fermented foods, and you want to be consuming, adding them to your diet, because these probiotic microbes have this beneficial addition to your diet to help you digest. So I have my clients eating meat with ferments, and I have them do it in a very strange or a very unusual way. Nobody else seems to have picked up on this, but I have my clients doing it. I don't have them chewing meat and swallowing it and then have fermented foods. I recognize that your microbiome begins not only in your face and your skin outside your body, but then it's present within your mouth. So within your oropharyngeal cavity are microbes. And you can really assess somebody's health by analyzing, sequencing those microbes. Kissing a sexual partner, your wife, a spouse, and they have a very pleasant mouth to kiss, they probably, by and large, have good microbes. But if they have bad breath and a bad smell coming from their mouth, or sometimes even their sinuses, they will be colonized with microbes that are problematic, maybe even pathogenic, meaning causing disease. So what happens, if you're listening today, what happens, do you think, if you put a piece of meat or food in that mouth filled with bad microbes and you chew it? what you're doing is you're introducing those bad microbes into the chewed up food bolus, the masticated, chewed up collection of food, mashed up by your teeth, your grinders, mixed in with saliva are all these microbes, many of which are going to be pathogenic and bad. If you got bad breath, you have bad teeth, you have bad dentition, you have bad gums, you have infection in your mouth. You've just feeded this food, collection of food that's going down into your stomach that's not going to be digested. You've started a course of action that is inimical to your best health interest. It's like you've taken raw hamburger and you put pus into it, something bad. What's going to happen to that raw hamburger? It's going to get, it's going to work. Well, same thing with your food. So what is the answer to that? My answer is, when you are eating food, eating meat, put a piece of meat in your mouth and hold it. Don't bite, don't chew. Put a piece of fermented food in your mouth, like kimchi, or a little bit of kimchi juice or sauerkraut juice, or a little bit of kvass, which is fermented beet juice, or even just a little bit of water, spring water, with a little bit of apple cider vinegar that's probiotic, that's fermented and has the mother in it, so it has living microbes. And you have these beneficial microbes now in your mouth. Then you chew the meat together with that, and you're introducing beneficial microbes into that food mass before you start swallowing. So what you're doing now is you're driving in a direction that you want to go. It's basically like you're heading in the right direction, on a car trip. Before, when you're just chewing meat without the benefits of those favorable microbes in your mouth, you're heading in the wrong direction, or maybe not a direct line to your goal that you want to get to. Now, anecdotally, what I found out is my own experience when I do this, I feel way better. Now, having said earlier that you got to be mindful of how you feel, what I mean by that is I can eat a lot more meat. So one of the places I go to, I'm fond of, are Brazilian churrascarias. These are Brazilian restaurants where they typically serve a lot of meat, and you can eat all the meat you want. And I noticed when I would go there, I couldn't eat so much meat. I'd kind of tap out at about 2.5 pounds of meat, and then I couldn't eat any more. But when I started to value or not care about how I looked at that place, but more about what I was eating, and the process of eating is usually after a fast. I started bringing in my jars of ferments. Okay, I come into the restaurant with these small jars of kimchi, and I would put a small amount in baby food jars. So I put lots of different ferments in there, and I started to put my meat in, chew these together. And what I noticed is I doubled the amount of meat I could eat at that churrascaria when I would eat with the ferments. So what happened was I had a greater tolerance and a capacity for eating meat that I think is more ancestrally aligned with how we would have been eating, because we didn't have refrigeration and freezers and the like. Food preservatives, thank God, 50,000 years ago. So when we caught an animal, we were all about eating that animal as much as possible before it would go bad. We would, consume everything we could off that, because we'd be going days again before we could get another meal. So I think this strategy of incorporating fermented foods, chewing it concomitantly, simultaneously with meat, is a very beneficial process that I promote and have all my clients doing, and I like to talk about it on the internet.
That was all new to me. That's fascinating. And I'm going to try that from tomorrow. Okay, so how about...
Well, the other thing, Nari, is you mentioned other strategies. Exercise, I think, is another one. So besides dietary, and I throw in dietary, fasting. So extended fasting, something that we talked about. I think that's kind of an eating strategy. So it's not just what you eat, but when you eat. and when you don't eat. So I think extended fasting is something that people should take a look at and consider doing. And then my exercise strategies are very, very different. Probably no surprise if you're listening to me, is this guy, Sean O'Mara, is very different than a lot of other people. So how I exercise is really can be defined by two attributes: very brief and very intense. So I exercise on average minutes a day, but I crush it. I scare people. People on social media stop following me when I put my videos up how I exercise. Because how do I exercise? I exercise like an animal in the wild exercises, a fight for its life. When a deer is trying to get away from an alligator or a wolf, it's not just trying a little bit. It's trying as much as it can. And the wolf and alligator, they're trying to kill that deer because they need a meal and they're going to die if they don't get fed. So basically, it's a life and death struggle every time an animal is exercised. They're not there visiting a gym, lifting weights, dropping some pull-ups and whatnot. When it's game on, it's life and death. So that's how I exercise very, very intensely. I exercise in such an intense manner that I can't even get a word out. I can't talk. I'm just about recovering myself. I'm breathing very deeply. My diaphragm is maximal excursion, trying to blow off as much CO2 as possible because my pH has dropped so considerably from an oxygen debt and a increase in carbon dioxide from the anaerobic state and lactate that I've achieved. And so it is a life and death kind of experience. And I'm guided by that because that's what happens in the wild. And so I considered that might be a benefit since all the animal species have that, except for one species called Homo sapiens. We no longer have that. We used to have it. I mean, we were more aligned with our environment and Earth in the past before we became civilized. And so we had these kind of life and death struggles with other animals, and indeed probably mostly from other Homo sapiens. So in law enforcement, I had an experience once as a police officer. I had many experiences as a police officer having to fight bad guys. Okay, so you'd fight, but it typically always went the same way. A bunch of cops, police officers would be trying to take somebody to jail, didn't want to go to jail, so it'd be kind of a big effort. We'd be trying to get this person in handcuffs, but it wasn't life and death. I mean, I always knew what was going on. In fact, sometimes I'd stand out and be looking, going, "Oh my God, why is this guy resisting arrest?" But one time it was me by myself, and I almost died. And it was a fight for my life. And I really did think I was going to die right then and there. And I could hear all the sirens, police cars coming in the distance because people saw me struggling for my life. And the challenge, the physiological state that went through my body was enormously very, very different. It is like no other struggle I'd ever felt. For hours, even probably the next day, I continued to feel the consequence physiologically in my body, having about 5 to 6 minutes struggling for my life, and with this bad guy. And interesting enough, I think what saved my life was it's kind of funny, but a morbidly obese 440-pound woman came and sat down on this guy who was trying to kill me. And it just provided enough of a diversion, to help, keep me alive, and me to hold on to this bad guy. So that, if more people had a life and death struggle, they would see the very different physiological effect it has on their body, and then have insights to how that injurious state, that physiological challenge, through a process called hormesis, that which does not kill you makes you stronger, has this benefit. And the animals in the wild are incredibly healthy. They live a life basically of being healthy all their lives to the very end, and then they die of something. And we humans are just the opposite. We quickly develop chronic disease, and our much of our life is in a disease state, and we live a long time, but it's mostly disease. So I think when you eat healthier and you exercise in a very intense manner, you get to enjoy a more prolonged state of health. It is a measurement that we call health span in the research research field of longevity and health. That is the period by which an organism enjoys predominance of health as opposed to disease. So I think fasting, eating mostly meat, eating ferments, and then exercise in a very tense manner gets you a more prolonged state of health span that is should be more ideal for more humans.
I love that. I love that message. You mentioned joint pain earlier on. So is joint pain an inflammatory state? And if it is so, then how do we prevent it, or how do we reverse it? Because I think one of the other areas that you're passionate about is inflammation, reducing inflammation. So I remember, in fact, one of your videos where you point out people's noses, inflamed noses tend to be larger and wider and generally sort of more reddish in color. So, but first of all, what is inflammation?
Yeah, so inflammation is a state in which the body has an inflammatory response. So it happens a couple ways. One, inflammatory molecules such as cytokines, adipokines, interleukin-6, these molecules that are associated with an inflammatory response get mediated. So oftentimes it's actually an endogenous inward biological response our body initiates from some kind of an assault. So it has a purpose generally to help open up the bloodstream. Vasodilatory effects of these inflammatory molecules will allow for swollen blood vessels, so more blood can get in there, and with more blood it's sort of like tunnels for the army to come in. So if you increase the blood flow to an area where there's disease, the body can help mediate a response to a particular disease. So you'll get inflammation where there's infection. You will get inflammation where there's an injury, where tissue has been harmed. You get this inflammatory response. And so it has a beneficial effect, but too much of anything is a bad thing. So if you have this inflammatory state too often, then you end up causing more harm than good. I mean, your body has capacity for tolerating this. So for instance, hormesis, which I mentioned before, is a process by which the body is exposed to something that's injurious. That which does not kill you makes you stronger. But ideally, you want these to be brief and intense. So for instance, when you lift weights, if you lift weights briefly, intensely, you destroy tissue. I mean, it's just part of what happens. You get an injury state, and then your body recovers from it. But when the process is very intense, so there's a lot of injury, but very brief, then you get the best results. If you do this too much and too often, you don't get as much of a return on your investment, and you can actually become more problematic for it. So there is a nonlinear shape to hormesis. You want enough, but not too much. Too much is problematic. So another interesting example of this is radiation hormesis. So if you Google radiation hormesis, there is some benefit to being exposed to radiation, where you see some benefit, but too much of it, then you get disease such as cancer and radiation sickness and illness. So there are many different forms of hormesis, and also another one would be fasting. So you want to fast to the point that you cause some harm, but not too much. And also heat. So you want to go into, excuse me, a sauna and be exposed to dry finish heat. and then have a response to it. But if you're in the sauna for too long, and the heat for too long, you can denature your proteins, and you can in fact induce a seizure where the body gets too hot. These proteins start denaturing. Usually it's about 106, 105 to 107 degrees, maybe 108. And people, and when their core body temperature gets that hot, they'll have a seizure, they'll have brain damage, and they may suffer permanent disability, which you won't recover from, and you may in fact die. So you want to find that sweet spot for this hormetic stress hormesis experience, where you just get brief episodes of intense things and not longer. So a good example to contrast exercise besides weightlifting is in the realm of movement, particularly in running. So what I advise my clients to do is don't do distance running, but do sprinting. So sprinting is something, and I'll pull up an example of this, which would be, I think, helpful to take a look at. Can you see this image behind me? Does it show up on your end for your audience? Can you see this
Yes.
behind me? Okay, so this is an MRI taken of a 58-year-old guy who's a distance runner. He was eating a low carbohydrate keto diet, was not eating carbohydrates. And we repeated his MRI, and he had this persistence of visceral fat in here. And this is a repeat MRI. And I was disappointed. I'm like, you should not have that visceral fat. It should be substantially reduced from your scan that you just had done a month ago. And why do you have it? So as it turned out, I asked him, were you cheating carbohydrates, eating some processed foods or carbohydrates, fruit or something? Are you stressed out? Did you have more stress? Stress will cause visceral fat. This white stuff in here is all the visceral fat. The white stuff out here is subcutaneous fat. So it's not visceral fat. It doesn't really have a problem. It doesn't cause an effect on your metabolism the way visceral fat, which secretes a lot of inflammatory molecules that I was talking about and causes this inflammation throughout the body, including joint pain. So this guy didn't have stress. He wasn't drinking alcohol, is the other thing that causes visceral fat, and then poor sleep. So those are my questions that I typically ask the big four. But a fifth one that I ask about is distance, durational exercise, chronic exercise. So if you're doing a lot of chronic exercise, distance running is the chief offender. Then we see a visceral fat becomes refractory to elimination, meaning it becomes more difficult and challenging to get rid of visceral fat when you've eliminated processed foods. If you keep running, your body wants to hold on to that visceral fat, probably unknown mechanisms, but we do see that there is some affinity for preserving adiposity, fat tissue, when you run. So it's really kind of a ridiculous kind of an exercise that people, fool's errand, I would call it, if you're heavy, to go out and run. I remember being, a distance runner myself when I was heavy, that overweight physician drinking the chocolate milk. I was running 75 to 90 minutes a day and not losing my fat. So what I've since learned is that if you stop running and you sprint, where a sprint is simply running as fast as you can possibly run, then you burn fat at an amazing rate. So much dramatically, you burn this fat much better than running. So here's an example. This is the best example I have found by MRI and imagery. And I could tell you about it, but it's better your visitor, your viewing audience sees it. So all this visceral fat that this guy had here from running 10 miles a day, 5 days a week, we got him to stop. And over the next 2 months, he simply sprinted instead of run. And so he sprinted briefly every day for, a few times, like 3 to 6 times. He'd do a 6 to 10 second sprint. So we're talking like maybe 30 to 60 seconds maximum running, but it was sprinting. and not jogging. And he goes from here to this point. So you should be able to see that this guy is eliminating almost all his visceral fat now by just that one change. Switching from jogging to sprinting eliminated all his visceral fat. But not only that, his shape changed. So he has kind of a blobby abdomen. Now he's got a six-pack. Do you see that nice oval shape? And his muscles grew. So sprinting grew his muscles, got rid of this very bad, even deadly fat, visceral fat inside of him, and made him not only functionally better, but more attractive. So he had a better physique. So sprinting is a wonderful form of exercise that you should be doing. It points out the very brief nature of exercise that I believe is desirable, and nothing else I can think of will get you more short of breath and as quickly as a sprint. I mean, I could go and lift weights for, very, very intensely for 30 seconds, or do pull-ups for 30 seconds, or, squat for 30 seconds or whatever. And I'm not going to be out of breath. I won't have achieved a oxygen debt. I won't have achieved an accumulation of lactate in my muscles as great and as significant as were I to have sprinted. So I share very zealously, strongly for audiences who listen to me to adopt a practice, consider adopting a practice of sprinting. And because of its incredibly hormetic benefit, better than anything else. And also in studies, we see the molecular response within the body, molecules, nothing else produces more lactate, which is this molecule of a combination, a hybrid between lactate and phenylalanine, as much as sprinting does. And so they looked at 10 different forms of exercise, and second to sprinting in producing lactate was resistance training, so lifting weights. So lifting weights is behind sprinting for this beneficial molecule that gets released when we exercise. And at the very bottom of the list of the 10 studied was running. So running hardly produces any lactate. So you really want to have a hormetic response to your exercise. The very best one to produce beneficial results is going to be sprinting.
Well, thank you for that. That's great to know. I didn't know that. Now that we can see the visceral fat just behind you, you talk about, in fact, you've talked in one of your videos, I think, of the correlation between visceral fat and heart health or pericardial fat. How are they related?
Yeah. So I can show, I have an image of that I can show you as well. So this is a image of an individual that had, in fact, a study on their heart, where we specifically used an MRI to evaluate and measure, assess the amount of fat around the heart. So in an MRI scan, fat shows up as white and muscle shows up as dark. So and so do tissue and muscle, other things. So this is the right lung, this is the left lung, and in between your lungs and your chest is your heart. And around this individual's heart is this large chunk of fat. So this fat is called cardiac fat, or heart fat, is inflammatory locally to the arteries that are externalized on the outside of the heart. Well known to Dr. Ovadia as a cardiothoracic surgeon, because he would do transplants on those arteries that were diseased, and he would have to cut through this fat to expose those arteries. So this big, huge, it's like a blanket of inflammation or wrap around these arteries, causing disease. This individual was able to eliminate dramatically his heart fat utilizing a elimination of processed foods. In this particular case, that's all he did. He's cut out processed foods, most of which were carbohydrates. If you think of processed foods are almost always carbohydrates in nature. But he eliminated his heart fat in just 13 weeks. So that's a dramatic visual for your audience to be able to see how beneficial eliminating processed foods are with regard to eating or reducing processed foods. So this series is one of my favorites too, that shows how visceral fat itself is eliminated by cutting out those processed foods. And this is the same individual that we did the heart scan on. He was a 68-year-old guy, and all he did was cut out processed foods. So your audience should be able to see this huge amount of visceral fat, and also this big streak of fat within his muscle here, his oblique muscles, how that is eliminated in 35 weeks. So about 7 months or so, he's eliminated that visceral fat by just cutting out processed foods and not exercising at all. Had this dramatic reduction of visceral fat and fat within his muscle, which a lot of people don't know about. But the relationship between visceral fat and heart fat is seen when we would routinely, my practice now, we will scan people's abdomens and we can see the heart fat going away. So here's another client who's got a large amount of visceral fat here and a large amount of fat around his heart. And over the course of 3 months, he goes to having dramatically reduced his visceral fat and dramatically reducing his heart fat. So the association between heart fat and visceral fat is a strong one. And I can almost always predict somebody will have a large amount of heart fat around their heart, inflammatory fat around the heart, if they have a lot of visceral fat.
Dr. Amarad, Sean, you said I could call you Sean. So we are running out of time. We are running out of time. But my last question to you is about thinning of the muscle atrophy. And I know it's not the same as sarcopenia, but how do we prevent the thinning of the muscle tissue, or in fact, how do we can we reverse sarcopenia? And it's not always age related.
Yeah, so one of the first, no, it can start very early on. And I use my own body as an example here because I would take a lot of photographs of myself. And one of the things I had that really bothered me was this belly that would stick out. That's an early dad bod, but it's particularly that angle from your iliac crest to about your belly button, and it starts going back, and it causes this almost a triangle that you see, it pooches out. And that's from the effects of visceral fat destroying your muscles. And it destroys them. One, it makes them smaller, but more importantly, makes them weaker. And so one of the earliest manifestations of sarcopenia, which is the loss of muscle mass and muscle performance, can be seen in the abdomen. It's very alarming, and it causes this dad bod. But what it really is, people who have a dad bod, if you're listening, and by the way, women can get a dad bod. It's a woman's bod, this little pooging out of your abdomen. What it means is your muscles are weak and can no longer hold your guts in. When you were a teenager, your muscles could hold your guts in, but sarcopenia induced from visceral fat has weakened those muscles, and you can no longer hold the same amount of your guts in that you could formerly do. But in reversing that visceral fat and living a healthy lifestyle, now I get to get better. And when I exercise, my muscles really respond. When you exercise and you got visceral fat in, they don't respond as well. So now I got a flat abdomen there. My muscle tone is much better. My muscles work better, so I stand upright and I have this great posture. I look, if you covered my head, like an 18-year-old. My vessels improved here. And then another example is just my own pictures of how I looked here, 5 years ago. And as I continue to exercise now, very briefly, very intensely, fast, and eat fermented foods and meat, look at the muscle mass. Now, do you see how my muscle is responding to that kind of exercise and my lifestyle? You would not see that in an average 55-year-old. you could maybe artificially induce it with hormones like testosterone, human growth hormone, but this is all natural. And the only way you're going to be able to achieve that is, to align nature, is stop opposing nature, which happens when you got a lot of visceral fat. So the first step to get rid of sarcopenia, loss of muscle, is get rid of that visceral fat.
This is how getting rid of the visceral fat, this is how important it is to get rid of that visceral fat. And if I had your confidence, and if I was, if I were as brave as you, Sean, I would put my photos up, because these are, I can so relate to these. My body also has transformed incredibly. So now at 50, I look healthier, and I am certainly stronger, and I have more of a muscle, more muscle mass than I did in my 30s 20 years ago. So I can absolutely relate to that. This was fascinating.
Awesome.
I can easily spend another hour with you, but I respect your time. So thank you so much for making time for my channel today. I really appreciate it.
Sure. Well, if anybody's interested in my work, they can see me at DRSEANOMARA.com, DRSEANOMARA.com is my website, and I'm at Dr. Sean O'Mara on Instagram and Twitter, if anybody wants to follow me, and Dr. Sean O'Mara on YouTube. So great places to find me.
I will put all the links below, so all you will need to do is just click on the link and it'll take you there. Thank you so much, and you have a beautiful day in beautiful Minneapolis.